Okay, good evening, everybody. And it's been a very nice day today. We have Dr. Arun Wadhwa with us, who's a very senior pediatrician. And he's been working since 29 years in south of Delhi and has been serving all the parents, basically, I would say. He's been serving all the parents so nicely that now the second generations and the third generations have started coming to him.
Not third.
No, the third is like gradually they will start coming in few years only. So I would not like much time to introducing and talking of this. I would just give the call to Dr. Wadhwa to talk about the COVID. What is COVID and children? How do we relate COVID and children? Because there's a lot of scares, a lot of fear related to the children, and we as a parent are not able to understand. There are a lot of different kind of studies which are coming in, and I think so we're all confused about it. So, sir, if you could, just give us some light on it, that would be really wonderful.
Thank you. From the outset, I must thank you for calling me. It is a privilege for me to be answering all your questions. And these days, as we know, last 1.5 years, people have been talking about nothing else other than COVID. Even if they talk about sports or politics or whatever, back of the mind is still COVID. Whether it's an election rally or Olympics, the COVID is there on the background. The COVID clouds are always there. And since schools are not open, children are at home and parents are working. So parents want children to go back to school. They also want to have normal lives. And fortunately, you asked me about COVID. So COVID disease as it is for children, fortunately has been very mild, so to say. We've had lots of children. In the second wave itself, we have records in our computer, almost 1,000 plus children I saw with RT-PCR positive. And all of them did very well at home. Only 2 children needed admission. So that makes it around only 0.1, 0.2% children who need admission. And these 2 also were admitted for 3-4 days, were given IV steroids, and 4th day they were back home. So if you see, even by the books, the admission rate for children in COVID is only 0.1%. Whereas for adults, it's 20%. So, that means COVID is much milder. In fact, most of these 1,000 children were detected only because parents in the house were positive. So they were tested and they were found to be positive. Otherwise, they were having no symptoms at all. Like in adults, they say 20-30% are asymptomatic. In children, 50% are asymptomatic. And even the symptomatic ones had fever for 2-3 days, 5 days. And out of these 1,000, we had maybe 8-10 who had fever for 10 days. And we got them tested, just the routine CRP and CBC, not those hi-fi D-dimers and all. So the tests were, marginally raised, and by 10-12 days, they were also fine. So out of 1,000 children, 10 had high fever lasting for more than 10 days, 2 needed admission, which makes it a very mild disease. And these 2 also were discharged within 3-4 days of admission. So it wasn't a bad disease for children. As the age grows, COVID becomes more and more severe. The older you are, the more severe it is. The more comorbid conditions you have, the more severe it is. So fortunately, as pediatricians, our life was not that tough. Only thing was counseling is what we needed to help parents out. And we were doing almost 12 to 15 hours of counseling sessions every day.
I can understand.
During the second wave.
It has been a very tough time for the doctors. And so we salute all the doctors for giving us such help during this time. But, with this third wave coming and with this fear of third wave coming and everybody saying that it is more scary for the children, how do you see this wave coming? And
So, this is by past experiences and mathematical modeling that we are saying third wave will come. But actually, nobody knows. Like most of the things we would say, God only knows. But here, I don't think God also knows. It's the virus which will decide. How will the virus decide? If it mutates slightly, probably nothing will happen. It mutates majorly, then the wave will come. Major mutation means that it will go and infect people who have already been infected. People who have been vaccinated will also get infected. So, major mutation means it does bypass your immunity. So that is why virus only knows whether it will come or not. But going by past mathematical modelings of all epidemics, waves do come, and all epidemics have usually got 4-5 waves. The second wave is usually the worst. It's something like a still pond. When you drop a stone in it, there's a big splash initially. And after that, you see those waves. And gradually, after 4-5 waves, it merges with the pond general water. So waves will come, but they will be much milder. And this is the first time that between the second wave, third wave, we vaccinated so many people. So we expect that the third wave will be even milder than what has been earlier, because earlier there were no vaccines so fast. The vaccines took time. So there were the natural waves, big one, small, 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 small. But now, since all, more than half the population is vaccinated, the waves will be much smaller.
Right. That's
why they're talking about children is because children are not vaccinated. So till now in India, only 18 plus are vaccinated. Even the developed world, only in a few countries, 12 plus are vaccinated. So the children will be involved more. Nobody has saying, so don't read into the lines too much. Nobody has said that they'll be more seriously involved. The numbers may be more because they're not vaccinated. Adults have been vaccinated or they've got the disease, so probably they'll not get the disease. If they get it, it will be milder. But children who've not been vaccinated, the number of children falling sick percentage-wise may be more, but nobody is saying that they'll be more seriously ill as compared to last time. So numbers like last time, 12% were children, whereas total population is around 20% children. So 12% were children. This time, in the third wave, probably 20-25% will be children. Just the numbers may be more because adults are safe because of the vaccines or previous infection.
And as they are saying that, because we have to change our lifestyle, this is going to be a normal virus. And now, so what all precautions we should take especially for the children, because not now, might be 6 months later, if some vaccination comes, we'll do some vaccination, but they'll start going to school, they'll start meeting the people. So how do you see, because you cannot ask the child to be totally, in a protected layer all the time.
No, it's not done also, because now that's why last 2 months we've been telling all our patients here that these number of cases, what you see in Delhi, 30, 40, 50, sometimes 70 also. So these cases will remain for a couple of months, if not years, probably years also, these cases will be there. So don't sit back at home. This is a good opportunity to finish off all your work. People need dental treatment, people need eye checkups, minor surgeries are pending. Some people have had elective surgeries which have been pending. So please complete that. And beyond all these medical things, this is a time when children should go to the park, play with other children, not in a big group, but maybe 1:1 or with your sibling, or at least maximum 5 people, maximum 5 children. But you should go to the park.
They can start in the
cycling. They can do cycling also. Or, not playing contact sports like football or something where you have 22 people running after a ball and people combining with each other. So, that will be a little too much. But, now the last week onwards, swimming pools have also opened. So imagine if swimming pools also open, you have to go out and have to lead a normal life. And children do need a break from their closed environment of the house, and the parents also.
Yes, actually, we have seen and we have received quite a lot of requests on this question also, that a lot of nervousness, child irritability, and a lot of problems because they are at home, the parents are at home, and parents are also stressed because of the work and the fear, because there's certain kind of a cloud of fear is all there in the house, and it is affecting us, giving us stress, and we are releasing it on our children, and the children are also getting affected. So how do we see, as a doctor, how do you see we should manage this whole situation?
So, what we have last 1.5 years seen 2 different kind of new sets of problems in children. Other than our old viral infections, dengue and all that, other than COVID, there is 2 new sets of problems. One is, in 1.5 years, children have gained weight a little too much. So normally 1.5 years, a child would gain around 3 kg. And people are there. Yesterday, there was a child who had gained 18 kg. There are lots of children who gain 6, 8, 9 kg also. So this tremendous amount of weight gain is mainly because of no exercise, not going to the park, no school. Children are at home, parents are at home, so they want to cook new dishes and tasty dishes. You will agree that most of them will have cheese and oil and butter. So anything sinful is not healthy.
Yes.
Anything tasty is not healthy. Broadly, I'm not saying in all the cases. So all these children have been eating well. The maids are not there. The parents are forcing them to eat also, and they're not exercising at all. So one is this physical weight gain.
Right.
And the second problem we've seen is mental issues. And these mental issues have been varying with children. So children who are around 3 years to say 6, 7 years, most of them have become very aggressive. They are breaking things, arguing, fighting. And, believe me, we've got so many children. In the first lockdown, our clinic was closed, so to say, for 3 weeks. And in 3 weeks, we had almost 6, 7 children with dog bite. So they were so frustrated sitting at home, but they were pulling their pets' tail, sometimes
Disturbing
pulling the
them.
tail, and obviously they will bite. Somebody keeps pulling my tail, I'll also bite somehow. It's like animal instinct that somebody, how long can you irritate somebody? So those dog bites had increased. So, and now this year, lots of people have kept pets also. So the
Yes.
number of children coming with dog bites has steadily increased. It's not only the number of pets have increased, it's also that they become aggressive, irritable, they're not going to school, so they want to play. The dog doesn't want to play, or the dog wants to sleep, or whatever, so that's one. And older children, say around 8, 9 years to 13, 14 years, 15 years, that's the time when most of the children like to have their friends around. They don't like parents to be around. Their friends are the primary source of information, and their way of stressing out their problems.
Yeah.
And since they're not meeting with them, fortunately, I must say that this time now, at least if it happened 5, 10 years ago, would have been even a greater problem. Now, at least they have things like video call and FaceTime and chatting with their friends, but still it's not as good as going to school and going around with them. So mental anxiety, depression, and in last 1.5 years, I've been referring children for counseling. I think probably maximum we referred in last 1.5 years to dietitian as well as for these counseling sessions. Maybe we otherwise would do 2, 3 in a month. And now last 1.5 years, we've been doing almost 4, 5 in a week for this counseling sessions, and even pediatric dietitians. So it's been a major change in lifestyle and lifestyle disorders for children. In fact, our Academy of Pediatrics, we've also started our own group of non-communicable diseases. Non-communicable diseases means other than TB, COVID and all. So this in children would include things like obesity, hypertension. All these have suddenly cropped up in such a big way that we have started a new group on this.
Right. It's much needed because the way it is growing, it is like somewhat scary. And I would just share my experience also. Like I'm being an art therapist, I've been dealing with the smaller groups in last 3 years, but the kind of the groups I'm dealing with the last year has totally increased. It has come number of, it has like exponentially increased, and the problems, as you said, very clearly, because the diet is not correct, the physical exercise is not there. The system is all gone into a very, hodgepodge situations and resulting in various different kind of side effects. So
yes. For these exercises you can do for physical well-being, but for mental breakout, psychological counseling is not the only way out. So you need some therapies like this, musical therapy, art therapy, and they really help them coming out of their depression.
Yes, because the children are very open, and indirectly you can just carve their way to move them out, and it has been really working very well, I would say. And God bless.
That's a good thing you're doing.
Yes, God bless. It's one of the things which can give little solace to such a situation.
Yes. So it's like soothing your nerves, as even like adults also, elderly population, we say that you must take up some hobby. So now this is something, art therapy, music therapy, you can do at home. Yes. And also relax yourself, divert your mind from the news channels.
Right.
In fact, we're telling everybody not to switch on the TV at all.
Yes, exactly.
Screen time has increased. One more thing I forgot to tell you, other than this, the screen time has definitely increased. And sometimes screen time has actually added to the problems because, they keep watching television, or the grandparents keep watching the news. Fortunately, last 2 months, it's been fine. But before that, every day it's the number of deaths, how many hospitalized, how many died, and bad news. So children used to have bad dreams and nightmares, and people used to come and say that, why don't you give some sedative to a child, something like Compose, and we said we never do that for children, because the child throughout the night has bad dreams and keeps talking about COVID only.
COVID, yes, or they have any traumatic situation in their house.
Yes.
The screen definitely has brought in a lot of different kind of fears, and media is not talking positive anyways. They're talking a lot of giving the different kind of data, whether correct, not correct, we cannot comment on it. But the children, when they listen, they're not even watching the screen, but they're listening. That is also affecting, I think so.
Yes, so we should take care that we should not discuss all these bad stories about COVID in front of children. They interpret in their own way. And
yes, exactly.
they have the very non-fertile side kind of mind, and they would imagine certain things which are not there at all.
Exactly,
They
rightly.
can't analyze. I wrongly said non-fertile. They have fertile mind, which analyzes by itself, which may not be the right way.
Yeah, they have their own capacity to analyze. No, I think so it is better than the adults they have, because adults' mind is all
reasoning is not there. The judgmental thing is not there. So
yes,
they can't make out what is true, what is bad. Whatever they see, believe it to be.
they just absorb it.
Yes.
And how do you see, Dr. Saab, how do you see this flu vaccine can help? A lot of parents have this queries. Can this flu vaccine help us to prevent our children from the COVID infections?
Yes, very interesting question. I think good you asked, because these days so many people come and ask us, why don't you give the flu vaccine? Because COVID vaccine for children is not available.
Right.
So flu will protect. So, incidentally, I'll tell you a little background also. We are writing a book on COVID vaccines. I'm one of the main authors. Out of the 25 chapters, I'm writing 6 of them. So it's a whole book on COVID vaccines, 6 chapters. And for children, this is a chapter I'm writing that, because the COVID vaccines are not there, we can use some other vaccines for protection against COVID till you have protection against COVID directly, like COVID vaccine for children. So, influenza vaccine, there is a lot of data worldwide which says that if you have had COVID, if you've had flu vaccine, the incidence of severity of the disease is less people go into hospitalization, less people reach the ICUs. Right. But this is all data for the adults. Like I told you, for children, as it is, they don't reach hospital and ICU very often, very rare. And these are all observational studies. And in medicine, observational studies are the poorest form of studies. Poorest form means it's just your observation, which could be biased also. So a real study would be that you give half the population flu vaccine, half the population water injection, and none of them know who got the vaccine, who got the water. And then you see how many developed COVID, how many did not develop COVID. And there is absolutely no study till now which has done this. So all these are observational studies done in Brazil, various parts of the world, that they found that people who received flu vaccine. So the only similarity between flu and COVID is that both of them are RNA viruses. So both of them are single-stranded RNA viruses. So when you produce antibodies against one RNA virus, the antibodies does protect you against the other RNA viruses also. But the immunity is very small, very less, and too short-lived. So please do not take the the flu vaccine thinking that you are taking a COVID vaccine for children, because it's not available. It's not a surrogate. It's not a substitute. Flu will protect you against flu. COVID will protect you against COVID. The cross protection is very less, and it has not been proven till now by science. Whatever we have done is only observation, which I would say, okay, I gave 10 flu, like my friend developed COVID. He said, I've been taking flu vaccines the last 10 years. That's why I was mild. But that is no theory. I know lots of friends who have taken flu vaccine. Even I have taken flu vaccine for last 12 years. I was also down with COVID and I was in the hospital for 5 days. So there is no reason to say that flu.
And I feel like people are saying that, people who had both the COVID vaccine also, they also got COVID.
So if 2 COVID vaccines cannot protect you, flu vaccine will not protect you against COVID. The main thing is that flu vaccine, why you should take, not to protect you against COVID, but because flu will protect you against flu. And soon now after rains, we'll get lots of fevers, lots of children with flu. We've already started getting flu. So if you've taken the flu vaccine, at least to protect against whatever can be protected. So the tagline is, get yourself protected against what can be protected. Protect against protectable. So what is protectable, you protect. Whatever is not protectable, don't protect. So flu will prevent you against all these viral illnesses. And when you get a viral illness, at least you're sure that it's not flu. So you think about COVID, but otherwise, it's not cross protection. That's important. And also we do that, we tell people, why do you take that? Because, if you take flu vaccine, everybody takes, the number of illnesses in the society will be less. The number of complications of flu will be less. So we are not overburdening the system with flu. That's already overburdened with COVID. So let's not add to the problems of the hospitals and the healthcare system. So there are other things why you should take a flu vaccine, but not to protect against COVID.
Yes. We do a very nice exercise in art therapy. We just try to, coming back to the main nutrition of a child. So we try to, teach up the children about the nutrition also. And you talked about the pediatric dietitians and the other stuff, but not all the parents, I would say, they're very comfortable going to a dietitian. And to somehow all during this period, we have been feeding a child all the turmeric drink or ginger drink or some kadas and all that stuff. Though I have a question here, this is my personal question, how good is that for children? And because we don't know how much quantity is good for children, might be, we make a drink which has cinnamon and which has ginger and which has turmeric, which is too warm for a child.
Yes.
So is it good to give them those things, or, how do we go about it, or what should be the proper nutrition?
Yeah, so, like you must have read during this COVID times, the maximum sales were by the so-called immunity boosters.
Yes.
So immunity boosters can be generally classified as things like zinc, can be classified into vitamin C,
Right.
the B complex vitamins, and then these Ayurvedic products. Okay. So, the only role here is of zinc, and the main role is because zinc is known to increase your immunity. And the most important thing is that zinc is not there in our diet. If you read up, zinc, the maximum best source is oyster sauce. Then you have beef, you have red meat, liver, and some form of nuts, and Brazilian nuts and all, which we don't eat. So that's why in us, we lack zinc, and zinc is scientifically proven to increase your immunity. But taking too much of zinc, taking zinc like 3-4 months will not help. So if you're deficient in zinc, it will boost up your immunity generally to everything, not only COVID, to almost everything. Next is vitamin C. So the doses of vitamin C which are required by our body are only 60-80 milligram per day, which can be provided with 1 glass of lemon juice. Nimbu pani pilo ho gaya. And the amount people take is 500 milligram, 1000 milligram. Everything goes out in the urine. You just need 80. After that, rest is out in the urine. So it doesn't have much role. Yes. B complex also has some role, something like vitamin C and zinc, but minimum role, not much. So what happens if you're deficient in some B complex, if you're deficient in some product, a mineral, then it builds up that mineral. So immunity comes back to normal. So, but it cannot boost your immunity beyond the level. And similarly with herbal things, all these things are not bad. They're very good in Ayurveda. They have been used since long. Cinnamon, haldi, ginger, all that. What we need to know is that they should be pure products. And suppose you're using ginger, you should use the raw ginger rather than the ginger powder. Haldi powder, so haldi powder has maybe color in it, maybe has atta, maida added to it. So use the original haldi, take a small piece, boil it in milk, and then you can give it to a child. And haldi has definitely been proven to increase your immunity, and it has antiviral properties also. So it does help, but do not take haldi and think that now you will not get COVID. You can roam around without a mask. You can hug people, greet people, kiss people, or sit with them without a mask. Healthy will not give you superpower. So it will give you some immunity. Some immunity depends, means what will happen is that suppose you were supposed to have COVID and you were down for 10 days, you might be down for 8-9 days. Okay, so that is what it will help, but it will not prevent you from getting COVID. Even the vaccine doesn't do that much.
Yeah, I think so. It is more psychological, sometimes we say.
And since there is no harm, we don't want to discourage. And there is some good to it also.
Yes. So normally, as we say, it is more psychological also than when we take something, even a sugar pill, and if we know somebody tells us that it's going to release your pain. So you have that.
But then otherwise these days, scientifically, we say no sugar. Sugar is like no, salt is no. Salt and sugar are the worst enemies of human health.
Oh, it is so confusing, different kind of theories coming in from all sides.
But sugar pill is more what you said as like a placebo,
placebo effect.
Large amounts of sugar. So children are drinking so much of sugar these days, sitting at home, that's why they're gaining weight.
Any more suggestions you would have for a parent to take care during this time?
So I would say as of now, definitely take them out. Not to crowded places, but definitely to places where there is good ventilation outdoors. The weather is good before the dengue season sets in. Go to the park also. Go and meet friends, not large numbers, maybe 1:1. A family which are, you can bank upon. If they fall sick, they'll tell you. And definitely less of screen time. That is very important. Minimum screen is the school time. And after that, keep watching the number of cases which are happening in your city. Sorry, like in our city in Delhi, in the large population of 20 million, we are supposed getting 30, 40, 60 cases, it's fine.
Yeah.
So once they start rising, so at the figure of, we would say, once they reach around 200, 300, start getting inside, and they reach 500, definitely lock yourself inside, like what you did in April, May, or last year in March, April. But till then, just keep a watch on the number of cases, keep a track on the positivity rate, definitely go out and do some mental airing. I'm not telling you to go to Simla, Masuri, Nainital and get into the crowd.
It's all jam-packed. It's all jam-packed. You know, you've
Get
seen
into the
this.
crowd. So go to the park, go to your friends, relatives, grandparents, you know, they're also missing you. So please do start socializing with maintaining good physical distance, not physical distancing, but social
That is
distancing.
very necessary for the children because 1.5 years they've been into the jail. And
Yes.
I think that their growth has stopped, sort of a certain, you know, the growth is like bit
So
constricted.
even the grandparents who are staying alone are feeling depressed. So they also need you and grandchildren to be around for a while.
That's nice.
Best would be if your grandparents are staying in a hill station or some far off place.
Wow.
If the schools are online, you can go and stay with them for a while.
Yes, I have seen few children doing that. They are stationed in their, you know, hometowns and they're doing their classes from there. And that's also a wonderful thing.
Lots of parents are also doing, because parents are also online, the children are online, so they have gone to their remote villages, hometowns.
Yes.
From there they're working.
That's a wonderful thing what they have done. Some few people.
Only thing they need is a good Wi-Fi connection, and after that, life is same as here with
Right.
good air.
Yes, I think so. The Wi-Fi connection is the most important thing these days, you know, for everybody to have.
Yes.
Yes. We never used to imagine that we can do a therapy session online. You know, I never imagined myself doing a therapy session, especially the art therapy session online. But yes, we learned it and you know, we did it and it happened well. It went well. So it's
If we keep waiting for physical interaction, then art therapy and all will never progress. So it has to be done online. Maybe you can do once a week, twice a week interaction, and then follow.
So normally we are doing it twice a week now.
Yes.
And for some severe cases, I take it 5 days a week because that consistency is needed sometimes to maintain, you know, to maintain that momentum with the child, starts getting to, you know, release some pains through art. So according
once they meet physically, I think they feel more comfortable and more, you know, as if they're there only. Once they're there physically.
Physical definitely becomes much easier because you can create the ambience for the, you know, child to do something and give them the special techniques. Now you have the limitation online that you have to ask them, okay, you have this, so you can do with this, try something like that. But if they're coming to you, you can give them plenty of different kind of things to play with. You have so many toys in your clinic always, you know. So I think so. We all, like even my children always look to those. Okay. Yes.
So these days, that's another one thing important, interesting. You know, all these children were so scared of coming to the clinic to get injections. Right. Now, 4 years, 5 years old, they say, uncle के पास जाना injection लगे, हाँ कोई बात नहीं चलेंगे, खेल के भी तो आएंगे. You know, it's like this.
I know.
Yeah, at least घर से तो बाहर निकलेंगे. That's what, you know, they're so craving to go out. Yes, that they don't mind coming here, getting an injection also, but they want an outing desperately. Even that injection is fine for them.
It's so sad to see, but it's okay. It's life. It's a part of life. They learn.
For us, it's better. They're happy to come.
Yes. Yes. So what would be your last message to the parents, you know, you would like to give? I've taken a lot of your time. I think so.
No problem. So if we are helping anybody, it's good. Our pleasure. Yeah. So last message, I would say, don't be paranoid. Don't keep watching television. Don't get into too much of Googling and social media. And keep yourself mentally happy. And if you're happy, if you're mentally ventilated, the children also follow. You know, whatever we do, whatever we think, our anxieties, everything is transferred to the child without your knowing. So it's also some kind of Wi-Fi system which functions between parents and children. Your anxieties also go to the
that child. Works 100% all the time with all the you know, full.
You know, if you don't say anything, they can make out. So
yes, exactly.
You also be happy, children also be happy, and then definitely go out. And if you go out with the child, you're also mentally airing yourself, the child also, and your child is in front of you, so you can see what the child is doing, who the child is interacting with, And you can also keep a close watch on the people they are interacting, and at least he's not removing his mask. Take a sanitizer with you if he does swings and all. But this is a good family bonding opportunity, and we must find some opportunity in adversity also.
Okay, I think so we have covered all the questions which came, the precautions and the mental health and the outbreak of the third wave. So I would like to thank you for your time. And I think so if we have some more questions, we would request you some more time, after a few days.
Will do.
Thank you. Thank you so much.
Thank you.
Thank you. Bye-bye. Take care.
Thank you.